Why it matters, because this is where you show your worth. This is where people get to know who you are when they read your notes. This is how you know the critical thinking and how much information they got and what was important for them to make an impression. So it's really, it shows your clinical value. And so it's kind of your print, that your paw print or your imprint. I don't have the words right now to describe who you are as a clinician. It's through your notes. But one of the things that I really want to make sure of is that it's one of the most important skills, clinical skills, that you have to develop. You will develop it your whole career. It's going to continue to improve and get better as long as you are in the field. I'm so happy when I see that my notes are evolving and I find new ways to say things. It keeps evolving after 25 years. And so we just have to realize that. I just want you to understand that it's not beside your job. It's part of your job. It's half your job. It is half your job. We got to get it in. Imagine if you work in a hospital and the doctors just write notes at the end of the day. So here you are in a hospital all day and you have no notes on your patients. The nurses write their notes at the end of their shifts. The OTs and PTs write their notes the next day in 2 days. We all need notes, reports to make a clinical impression. We draw it from the assessment, but we draw it from clinical impressions from other reports. So your notes is as important as the activity that you do with the patient. It is half your job. Don't say I'm just gonna do therapy right now. I'll do my notes when I have time. It is half your job. And I'm saying this because this is the part that I struggle with the most. I still struggle with it whenever I go to different settings, is making sure that I have the dedicated time to write that note. Even if you have to cut the session short to make sure that you write that note, it's super important. Sometimes in rehab, I do half-hour sessions and it takes me half hour to write that note, especially if you work with aphasia.